If you don't have any symptoms but are in the high-risk age category for the coronavirus, should you be tested?
And should healthcare workers be wearing their scrubs when leaving the hospital? WBZ's Dr. Mallika Marshall is answering your questions tonight.
MJ writes, my live-in boyfriend helped his mom in her house, and while he wore a mask, she did not. They stood next to each other. She works in a store and is around customers. Could she have put him at risk for COVID? So whenever you're around anyone in close proximity, you really should be wearing a mask. Otherwise, you could be putting them at risk of developing or contracting coronavirus. Our next question comes from another viewer who writes, why are hospital employees allowed to wear scrubs to and from work? So you're likely going to see healthcare workers walking around with scrubs on, but that doesn't mean that they're dirty or contaminated. Usually when we perform procedures or we take care of COVID patients, for example, we're wearing gowns or other protective equipment that spares our scrubs. Plus, a lot of people actually change their scrubs before going home after their shift. So don't worry if you see healthcare workers wearing scrubs. It doesn't mean that they're dirty, and they're unlikely to put you at increased risk of COVID or any other infections. Elizabeth asks, what are your recommendations about traveling out of state to visit grandchildren and grown children now that restrictions are being lifted in many states? So if you or anyone you may be visiting is at higher risk of developing COVID-related complications, you probably should think twice about it. People who are at higher risk may not be able to enjoy some of the same freedoms that people who are at lower risk may be able to do at this time. And a lot of states are still requiring that people self-quarantine for 14 days when they visit their state. So this is a question for your primary care doctor. Give them a call and ask their advice. Our next question comes from Lisa, who writes, I'm 65 and my husband's 63. Should we get tested even if we have no signs of having COVID-19? What about having the antibody test? So antibody testing is not widespread for the public. In terms of coronavirus testing, if you don't have any symptoms and you don't think you've been around anybody who's been infected with coronavirus, then you really don't need to get tested right now, because it really just is a moment in time. So you could test negative today, but then go out and about tomorrow and be exposed to coronavirus. So if you develop symptoms of coronavirus or you think you have come in contact with someone who has it, then give your doctor a call to find out how you can get tested.
And Dr. Mallika is offering her best advice, but you should consult with your own doctor before making any decisions about your health. If you have a question for Dr. Mallika, there are 3 ways you can reach out to her. First, her email, drmallika@cbs.com, on Twitter, @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.